We're going to go over the technique of forearm fasciotomy. And one of the important parts about this procedure is planning your surgical incision. Your surgical incision needs to allow you to do a number of things. First, you want to have access to the medial side of the arm, so in case you need to expose, repair, or address the vascular structures on the medial aspect of the upper arm. You want to cross the elbow joint obliquely. Likewise, you want to cross the wrist joint obliquely and have an incision that will allow you to release the carpal tunnel and extend this into the hand. It's also not a bad idea to have a skin flap at the wrist that can be laid across the median nerve and flexor tendons, particularly when you're not going to close the skin incision. So what we've done, we've laid our incision as if we were going to do the entire upper extremity, and then we'll begin our incision here at the elbow. Now I'm going to stop this incision at the wrist. Depending on the clinical situation, you may choose to continue across the wrist and do a carpal tunnel. You may need to extend the incision proximally. So once we've developed our skin incision, you pretty rapidly encounter the volar or palmar forearm fascia. Then we'll starting with the anterior compartment, we're going to make a small incision in the fascia. Identify our fascia and then release our fascia. I'm going to develop the skin flap here down at the wrist just a little bit more. Well, there's longest. All right. Great. Now, depending on the clinical situation, the individual forearm musculature has well-developed fascia, and so you may elect to release the individual muscle fascia. There we go. Okay. So we released our volar compartment. We're going to move over here and release our mobile wad. We'll make an incision in the fascia. And release that again with our scissors. All the way proximal. Okay. So we released our mobile wad. We released our anterior compartment. Structures of note: flexor carpi radialis, radial artery is right here. And then if we looked at the wrist, palmaris longus, median nerve is also visible right there. Again, depending on the clinical situation, you may elect to go across the wrist and release the carpal tunnel. You may elect to go above the elbow and up into the upper arm, depending on your clinical situation. Because the individual muscles in the forearm may have a well-developed individual muscle fascia, You want to explore and make sure that there's not a muscle that has remaining fascia that still requires release. Similarly, at the wrist, you want to ensure that your fasciotomy is complete distally, and again, the consideration of a carpal tunnel release may be entertained. And again, notice our incision design allowed us to lay this skin flap loosely and cover up our median nerve and flexor tendons at the wrist. Dorsally, you're going to use a single longitudinal incision After making the skin incision, you're going to expose the extensor compartment or dorsal compartment of the forearm. Then we'll make a small incision with using a 15 blade. And use scissors to release our compartment. We want to ensure that this fascial release all the way to the origin of the muscle. You can check it digitally with your finger. Distally, you want to stop just before the wrist and try not to release the extensor retinaculum of the wrist unless the clinical situation requires you to go farther. And to a lesser extent compared to the anterior compartment, you want to explore the individual muscles, and you may need to release some of the individual muscle fascia. Okay.